According to the World Health Organization, over 350 million people in the world are living with viral hepatitis, which can be identified as A, B, C, D, or E. Hepatitis is an inflammation of the liver that is caused by a variety of infectious viruses and non-infectious agents, leading to a range of health problems. World Hepatitis Day is celebrated every 28th of July to step up national and international effort on hepatitis, encourage actions and engagements by individuals, partners, and the public. This year's theme is tagged, "It's Time for Action," a call for better global response. Joining us from Abuja studio is the National Coordinator, Civil Society Network on Hepatitis in Nigeria, Dr. Nsebasi Ekanem. Good morning. It's good to have you join us.
Thank you for having me. Thank you. It's a pleasure.
Now, talk to us how far we've come with addressing this seemingly silent killer virus over the years. Despite we, celebrating this day, what has been done? How aware are Nigerians about this infection?
Okay, thank you for that question. Yeah, so today is a very important moment for us to reflect on the progress we've made as a country, as a continent, as the world altogether, as regards our target of eliminating viral hepatitis from our country by the year 2030. And suffice to say that despite the fact that, yes, there has been improved diagnosis, there has been improvement in terms of the cost of medications, basically antiviral agents for viral hepatitis, access to testing and treatment is still a problem. And basically because of the poor funding for viral hepatitis programs. As we speak today, hepatitis kills at least one person every 30 seconds. So from the time we started this conversation till now, 6 people have already died of viral hepatitis, and that's the real truth. And these are actually people, not mere statistics. They are people like you and I who have to go because they have viral hepatitis that has not been properly treated. So it's important that we as a country look at what we've done so far. Unfortunately, funding for hepatitis in Nigeria is very, very paltry. Unlike HIV, tuberculosis, malaria, that kills less number of people compared to hepatitis, they receive funding from the Global Fund. They receive funding from, other sources like the President's Emergency Program for the relief of HIV and AIDS. But hepatitis doesn't have. So patients still have to buy their medication from out of pocket. And we know the situation of the country now. So most patients do not have access to medication because they can't even afford it. So we have not done well so far as hepatitis is concerned. And every year, globally, 2.2 million people get infected every year for a disease that has a vaccine. And the vaccine is highly potent. This is what I mean. Once you take the vaccine, you are not supposed to be infected with the virus. But 2.2 million people are still infected every year. What does that tell you? That universal birth dose immunization for hepatitis B is not getting to the last mile. It's not getting to people who need them. It's not getting to newborns. So we must look at it this way. So honestly speaking, in terms of assessment, we've not done well. And it's a clarion call for all of us to go back to the drawing board and see how we can invest, particularly the government and international development partners, because we have not done well. Treatment is still very difficult to access. Diagnosis is difficult to access. Even vaccination that would help to prevent the next generation from getting this virus. These things are not available. So yes, we have not done well. But for us, it's a clarion call to do more.
And with these figures that you have read out also, calls for the need for awareness on this disease. But the theme for this year says it's time for action. Does this speak to the need for more, funding as regards diagnosis or treatment? Which is more important at this time?
Well, the whole cascade is important. From awareness, like you rightly mentioned, the awareness is very low. As I speak to you, not up to 10% of people who are living with the virus know about the disease. Some of them, even when you have that conversation with them, they'll probably tell you, oh, are you talking about hypertension? Because they don't even know what you call hepatitis, even when they are living with the virus. So the awareness is low. And if the awareness is low, how would they even go for diagnosis? How would they go for screening? How do they even go for testing? So we need to be able to increase funding to finance the whole cascade. Awareness, screening, diagnosis, treatment, and prevention through vaccination. It is important that the government of Nigeria takes this up as its own responsibility. Why? Because Nigeria is an epicenter for viral hepatitis. We have the highest burden of viral hepatitis in Africa. So we need to take this personally. The government needs to stand tall, work with its agency and with civil society. Good enough, the civil society network on viral hepatitis, as I speak to you, we have a program that will be running across the 36 states of the Federation during the World Hepatitis Day commemoration. We are going about doing testing, doing awareness, doing balance counseling, and providing vaccination to newborn infants, supporting the government in ensuring that newborns or infants have access to hepatitis B vaccination. So it's important that the government, invest. Good, okay.
Right.
So what I'm trying to say is that HIV, malaria, and the rest, they have funding. But hepatitis does not have funding. So I think that the government should take this one as its own responsibility.
We hear you, Dr. Nzabasi Ekanem. Now, the question I want to ask is this. I'm asking you two questions in one. One is the fact that you said that Nigeria has the highest burden in Africa. How so? Why is that so? Because often the time we hear when we talk about certain diseases, Nigeria is often said to have the highest burden. What really is the indices for this record that you have put out just now? That's on the one hand. And then when we are talking about people not understanding the fact that they have this infection, perhaps we need to educate people on what the signs and symptoms are for them to go to the hospital to prove that perhaps they have hepatitis.
Yeah, so thank you very much. In terms of the proportion or the burden of hepatitis, Nigeria definitely, as we all know, has a very large population. We are the largest black nation on earth. And so even though the proportion may not be the highest in Africa, but when you compare to the population size that we have, you now realize that it is the highest burden in Africa. And the reason is because newborns are exposed to the virus. Our PMTC approach, that is prevention of mother-to-child transmission, is not is not widespread. See, the thing is, for you to be able to reduce the burden of the virus, you must be able to ensure that every newborn child has access to birth dose vaccination within the first 12 to 24 hours of birth. Unfortunately, that is not really much available in certain settings. We know that the government of Nigeria has, working with Gavi and other partners, have initiated the birth dose vaccination. But you see, availability at the last mile is still a challenge, and that is where we need to actually address so that every newborn child can have access to the vaccine. Again, we also need to ensure that every woman, every pregnant woman during antenatal visit has access to screening, hepatitis B screening, because once we know the status of a woman, we can take steps by giving her safe antiviral medication to ensure that we reduce the viral burden within her system so that the child does not even contact the virus during gestational period. And after birth, we can also ensure that the child has access to vaccine to ensure that the child doesn't come down with the virus. And then that is as far as the burden is concerned. If we're able to improve our PMTC approach, that's prevention of mother-to-child transmission, we can drastically reduce the burden of the virus in Nigeria. As regards the symptoms, we have quite a number of symptoms. But one thing about viral hepatitis is that it is highly asymptomatic, which means that most patients who are living with hepatitis, they feel very well. They feel very fine. They don't see these symptoms because the liver as an organ, which is the target organ that hepatitis actually deals with, is able to regenerate itself. So even when the liver is almost damaged, it still functions as though it is optimum, as in optimum health. So we often tell patients not to wait. We tell individuals not to wait until they start seeing the symptoms. Go for screening. Once you are screened and you find out that you have the virus, there are effective treatments that can help to improve the quality of life and to reduce the occurrence of complications due to hepatitis. But for the symptoms, we have quite a number of them. We have dark-colored urine. Most patients who come down with hepatitis and start manifesting symptoms of liver damage, they manifest jaundice-like symptoms like dark-colored urine, tan tools, yellowing of the eyes, even yellowing of the skin. Sometimes they complain of abdominal pain, fever, loss of appetite, loss of weight, and sometimes they even begin to have symptoms like extreme fatigue, extreme tiredness. But we often say, at this time, once those symptoms manifest, it's already too late most of the time. And because we don't have a cure for hepatitis B, we often tell individuals, don't wait till these symptoms manifest. Because by the time the symptoms manifest, it might just be too late. Go and get tested. Once your status is known, seek counseling from a qualified medical professional and then proceed to take the treatment. Now, the WHO guideline has revised the whole treatment plan so that now we have more people. We have the threshold for treatment has been reduced. So more people are now eligible to take treatment. More people are now eligible to go for the advanced diagnostic procedure. So that means that people should be able to go out there, get screened, so that once their status is known, they can be treated. And I can tell you this for a fact. If you are screened on time and your status is known on time, you can be treated and you live your life to the fullest. But when you wait till those symptoms that I mentioned manifest, things may really be too bad for rescue. So we are calling on people to go get themselves screened and get treated.
And so you also mentioned funding, which may be deterring some Nigerians from accessing proper health care. That's a major factor in this part of the world. How can Nigerians, leverage on the health insurance scheme to access this form of health care? And what is the place of the vaccine? Is it just for prevention, or it also covers, management of some of these symptoms? Since you mentioned that there is no cure for it at this time.
Okay, thank you. First of all, we have the National Health Insurance Scheme, and that's a very fantastic approach. But sometimes, for the medication for viral hepatitis, some of them are not covered in the insurance system, in the insurance scheme, rather. And we are calling on the government to ensure that hepatitis, the whole cascade of care, from diagnosis, treatment, even at the point where maybe a liver transplant is necessary. All of this should be captured in the National Health Insurance Scheme. The good thing is, one of the things are that one of the major causes of cancer on earth is hepatitis, because
Dr. Kanem,
hepatitis B and C are the major causes of...
Can you quickly hold the thought? We need to quickly go for a break. When we return, we'll continue this conversation.
The new Milo 3-in-1 Milky and Creamy is truly milky and contains calcium. No need to add milk for that rich, creamy cup, which helps to nourish and energize your kids.
Milo! There has been an increasing trend of cholera cases across the country. Cholera is a highly infectious disease which spreads through contaminated water, food, or direct contact with an infected person's feces. Symptoms include diarrhea, vomiting, and dehydration. Together, we can fight the spread of cholera by saying no to germs. Wash your hands regularly, disinfect your homes and drainages with hypo bleach. Stop open defecation and keep your toilet germ-free with Hypo Toilet Cleaner. Together, we can prevent the spread of cholera by disinfecting with Hypo.
Hypo.
Thank you for staying with us. We've been talking about hepatitis because today is World Hepatitis Day. And speaking with us is Dr. Nsabasi Kanem, who is the National Coordinator, Civil Society Network on Hepatitis. And before we went on the break, Dr. Kanem was speaking to the issue about the cover, that's the health insurance, how it is that it doesn't cover for some of the medication, because my colleague here, Olamide, was questioning if people can, use that, take advantage of that for treatment.
Okay, so I was trying to say that the full cascade of care, from diagnosis to treatment and even to more advanced procedure like probably liver cancer in cases where there's already, liver transplant when there is already liver cancer or liver failure. Unfortunately, a lot of these are not covered in the insurance scheme. And there's need for the government to ensure that we have all of this covered so that patients can be able to access care. I really must say here emphatically that hepatitis affects the poor disproportionately compared to the rich. Most of our hepatitis patients are on the lower echelon when it comes to socioeconomic status. So which means that most of them do not even have money to pay out of pocket. So it's important that the government should ensure that the National Health Insurance Scheme covers from the diagnosis, because the diagnosis for hepatitis is expensive. Just one of those tests is almost about 60,000 naira. So it's important that the diagnosis is covered, the treatment is covered. It's possible for the Nigerian Federal Ministry of Health to have an engagement with pharmaceutical companies within the country to ensure that we are able to bring in hepatitis B drugs. Basically, for now, the gold standard is tenofovir. We can bring in tenofovir at a very affordable cost so that it gets to the patient who need them at a very affordable cost. So if we are able to do that with the influence of the government, patient can be able to have access to medication. And like I did say in my last point, that the WHO have revised the guideline. Now, with the new guideline of WHO, more people, up to 50% of patients, need to be on treatment. The question is, if many people who currently are supposed to be treated don't even have access to treatment, when the new guideline is implemented and more people need to be on treatment, how would they be able to go on treatment? And remember, anti-hepatitis medication, the antiviral medication, being antiviral medication, it needs a compliance of 100%. That means when patients start that medication, they need to continue to take it. Dropping out of medication is worse than not even taking. So it's important that the government allows the insurance system to support the whole cascade of care, even up until the point where there is liver transplant. That's on the cost. Now, regarding the other aspect that you talked about, I think you talked about
the vaccine for treatment or for prevention. If you can hear me.
The vaccine. Okay, yeah. Yes. So the vaccine is purely for prevention. It's purely for prevention. There is no vaccine for treatment. Vaccines there are two kinds of the vaccine. We have the one that we call the universal birth dose vaccine. That one is given within the first 24 hours of birth to ensure that a child born will not contact the virus. Because the truth is that any child that has the virus or contracts hepatitis B virus at birth has a 50% chance of dying from liver complications. Now, there's another one that we call the hepatitis B immunoglobulin. That one is given to a child that is born to a hepatitis B positive mother. So if a pregnant woman is seen to have hepatitis, diagnosed with hepatitis B, during the point of birth, there's the hepatitis B immunoglobulin is given to that child within the first 12 hours of birth to ensure that the child haven't had that contact with maternal blood, with the mother's blood, will not come down with the virus. So there are the two kinds of virus, but they are mainly for prevention, not for treatment.
Unfortunately, we do not have as much time to address the various types of hepatitis. We have A, B, C, D, E. But how is this day, or what's the plan of your society to commemorate this day?
Okay, thank you very much. Like we said, it's time for action. Enough of the rhetoric, enough of the gainsaying. Right now, we want the government and international partners to focus attention on making significant financial commitment to viral hepatitis elimination. For us as a civil society network on viral hepatitis in Nigeria, we will be working with the National AIDS and STI Control Program, NASCAP, at the federal and at the state level, the SASCAP officers, to implement hepatitis B, viral hepatitis elimination program. So we are going to be doing road shows, we are going to be doing screening, we are going to be doing even vaccination, we are going to be doing counseling, we are going to be referring positive patients for more testing and for care. So we are doing that across the 36 states of the Federation. Every state will be having an activity. So we are calling on Nigerians to identify areas where these activities are holding. Unfortunately, because of time, I cannot reel off all of the centers, but try and go and get tested in any of these centers and know your status so that you can get treatment. So we are having this activity. We are also using the opportunity to call on the government to please prioritize hepatitis B, viral hepatitis is an orphan. It kills so many people, but nothing is done about it. The government needs to own this one up so that we can ensure that the next generation will be free from viral hepatitis. Yes, the private sector, we are calling on the private sector. We have a multi-billion-dollar pharmaceutical companies in Nigeria. The private sector, the pharmaceutical company must come together. But you know, why I call on the government is that the government will bring all of them together and say, look, this is a commitment that we have. We want you to rally around this, and we want you to stamp out viral hepatitis in Nigeria, and everybody will comply. Thank you.
Dr. Nsabasi Kanem, National Coordinator, Civil Society Network on Hepatitis. Thank you for your time.